Uni Hello, my name is Betty Chingy, the student University Catholic Santiago de Guayaquil. My topic is Mucocutaneous Manifestations of Scurvy. Definition: Scurvy is a syndrome that reflects on the skin, mucosa and annexes, instability and weakness of non-hydroxylate collagen secondary to body vitamin C deficiency. The most frequent cutaneous manifestations are follicular hyperkeratosis, follicular purpura, ecchymosis, cirrhosis, edema in the lower extremities, slow wound healing. Next, we will.
What is scurvy? To give an idea, here is a little story of a person named Jack. One day, you noticed Jack entered class looking weak and tired with red spots on his skin. You ask him, "What is wrong?" Jack replied, "My muscles and the joint areas feel weak." As he spoke, you noticed his gums are swelling. You told him to go to the clinic to have a checkup. Upon entering, the nurse noticed red spots, so the nurse asked him what is wrong. He first mentioned about his weakness, muscle and joint pain. The nurse also happened to notice the swelling gums. Scurvy is caused by the deficiency of vitamin C, ascorbic acid, in their diet. It normally happens after 3 months after they stop taking enough of vitamin C. Children with autism spectrum disorder are at risk as they may pick food that aren't good sources of vitamin C. If left untreated, it may cause jaundice, edema, and fatal heart problems. Scurvy is treated with vitamin C supplements which can improve the symptoms. Joint pains will resolve around in 2 days' time. Most people will be fine in 2 weeks. Thanks to vitamin C supplements and more vegetables in his diet, he was able to recover within 2 weeks and can continue being healthy. He will always remember to eat his vitamin C-rich foods. To prevent scurvy, we must take the required amount of vitamin C. It is present in fruits and vegetables. Furthermore, vitamin C can be taken as a food supplement.
Application in nursing. Administration of ascorbic acid in variable doses. It should start with an attack dose 200 and 1000 mg days during the first 7 to 14 days until improvement. The clinical continuing with a maintained dose until achieving the definite cure. Next, we will see a video.
Water-soluble vitamins. Vitamin C or ascorbic acid. This is the most heat-labile vitamin. It acts as a strong reducing agent. Sources include citrus fruits, fresh vegetables, and amla or gooseberry being the richest source. Local concentration of vitamin C. Pituitary gland being the greatest, then the adrenal cortex, and then the corpus luteum. The daily requirement is 100 milligrams per day. Biosynthesis and metabolism. Humans and other primates cannot synthesize ascorbic acid due to deficiency of a single enzyme, L-gulonolactone oxidase. It is rapidly absorbed from the intestine and excreted in the urine as ascorbic acid, or its metabolites diketogulonic acid and oxalic acid. Functions. Vitamin C is required for wound healing. It is responsible for hydroxylation of proline and lysine in collagen, and oxidation of tyrosine and phenylalanine. It plays a key role in iron absorption by keeping iron in the ferrous state. It acts as a prophylactic agent against neurolatherism deficiency. Scurvy is a condition which is characterized by bruising, swollen gums, poor dentine formation, and poor wound healing. Wimberger ring sign refers to a circular calcification surrounding the osteoporotic epiphyseal center of ossification in scurvy, which may result from bleeding. It should not be confused with Wimberger sign, which is pathognomic of congenital syphilis. Hydroxyproline is deficient in scurvy. Here are some important points to note. James Lind is famous for a substitution of vitamin C in the English Navy. Linus Pauling first advocated consumption of megadoses of ascorbic acid to prevent and cure the common cold, as it is believed that ascorbic acid promotes leukocyte function.
Pros and cons. Pros: ascorbic acid is essential to maintain the integrity of the body, especially for tissue repair and collagen formation. Cons: large doses of ascorbic acid can interfere with blood glucose determination while using the glucose oxidase method. Issue apply in Ecuador. In Ecuador, there are many detected cases of scurvy that have been observed due to mucocutaneous manifestation and different tests. Most cases have been treated with doses of ascorbic acid. In conclusion, scurvy can present with specific and not specific signs and symptoms, reaching advanced stage for syncope and sudden death. In addition to a complete physical exam, it is important to require dietary history on questioning and if the medium allowance in carry out the corresponding ascorbic to diagnostic substitution. Thank you very much.